911 Global Meds Disclaimer. This video and any contents herein are posted on this YouTube channel of 911 Globe Meds for informational and educational purposes only. Please see the detailed video contents disclaimer and the copyright disclaimer in the text section below.
So my name is Brian Van Tine, and I'm the Sarcoma Program Director at Washington University in St. Louis, where we have a large program looking at very rare tumors. And one of the limitations that's come out in the treatment of these rare tumors is that the frontline therapy goes back all the way to the 1970s with doxorubicin, and really hasn't changed very much. We thought for a brief period of time olertumab was going to be an active and useful drug, but the announced trial that was announced at ASCO was negative. Our frontline therapy hasn't changed, and it's actually, in a lot of patients, toxic. When Pazopanib first came to market, we all began doing different things with Pazopanib. One of the things we began doing was lowering the dose and then dose escalating. And then we found that this was a more tolerable medication in a lot of people compared to doxorubicin. And so we formally tried to look at how we could do this in clinical trial with the patient population that we were afraid might not tolerate IV chemotherapy that well. And so we actually proposed and then are now presenting a phase 2 clinical trial using dose-escalated Pazopanib as a frontline therapy for patients that we don't believe should be getting IV chemotherapy, which is either the debilitated or, say, the elderly. What we found in our study is that it made both the progression-free survival and overall survival benchmarks that we had actually set out, and that we found that in the quality of life metrics that we were measuring, that whether the patients were responders or non-responders, we didn't see a dramatic change in quality of life, which is a good thing when you put somebody on therapy. And so we were able to show that in a subset of patients, we were actually able to benefit them. And that group of fragile patients that we treat, actually this is now an option. We have actually now, I think this is the second study looking at, say, the elderly population. There's a study out of Europe looking at doxorubicin versus Pazopanib had the same efficacy in the front line. And now we're looking at a more fragile population. Once again, Pazopanib in the front line seems to benefit patients. So I think that the patients most likely to benefit from the treatment approach are the ones that want to try something but that you're afraid not to give IV chemotherapy. At the same time, we know which subtypes of sarcoma seems to be a little bit more likely to respond, like synovial sarcoma, to Pazopanib. And so you can try this in patients that you may not feel that's comfortable giving more toxic chemotherapy to, but at the same time, those patients that want to try something. So I think what the data shows is that this therapy will be successful in about 2 out of 5 patients. And so if you're looking at resistance, the resistance front line versus any other line seems to be relatively the same. And so whether you use it front line or later line, I think it's equally efficacious at this point. And so therefore, you can go forward with the idea that, 2 out of 5 patients would benefit.